Welcome to Breathe California TV. Breathe California is the lung health organization for the state of California. Each week we give you a program on something related to lung health, mostly prevention. Today we're talking with Patrick Yam, who's the CEO of Somnology. He's going to explain what that is, but it's all about sleep. How to get the best sleep you can. So we'll be back in 30 seconds with Patrick, and hope you'll stay with us.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier. And after using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back to Breathe California TV. Our guest today is Patrick Yam of Somnology. Thank you for joining us, Patrick. First thing I think our audience wants to know is, what is Somnology?
Thank you, Terry, for this opportunity, and thank you, the audience of Breathe California. I applaud your focus and initiative to better inform your audience on health matters. And Somnology is an early digital healthcare company focused on the remediation of sleep disorders. And we are a knowledge leader that professes, we eat our cooking. I'll mention it that way. Whereas many in the field of sleep and sleep monitoring are focused on solely sleep monitoring, and so are we. In fact, we received an award last year for having the best sleep monitoring solution. But we go beyond that. We're focused on the remediation of sleep disorders. We are involved and engaged in clinical studies with with many of the leading institutions in the country. We just concluded a clinical study with UCSF Medical focused on health equity. The opportunity for many, irrespective of your background or your gender or your geographical location, to be able to access better sleep remediation. Okay. Today, we have a profound problem. The problem is the fact that there are 70 million people domestically that have sleep disorders, and yet there are only 7,500 board certified sleep physicians. Guess what? The math doesn't work. That's roughly a proportional ratio of one board certified sleep physician for every 20,000 affected by sleep disorders. My partner, Dr. Melissa Lim, and I established Somnology in the mid-2015. And Dr. Melissa Lim is quite a noted board certified sleep physician. She has ran and established and still continues at this current day to run the sleep center at Sequoia Hospital in Redwood City. She's seen thousands of patients domestically and beyond. And what we have done is to develop a defined graduated sleep care platform and program that goes well beyond the dictum of sleep monitoring. We can provide for you an evaluation of your audience and your workforce, and we do to many employers or prospective employers. Go from there to being able to provide the employee through employee benefits an opportunity to access your sleep data while wearing the Somno ring And the Somno ring you adorn while sleeping at night. In the morning, it transmits the data on a heavily encrypted and highly secure basis to our servers, and the servers then generate the information to provide you a comprehensive and immediate sleep care report. The data is then forwarded, transmitted to our healthcare specialists, who you can schedule with via telehealth to be able to provide you a 10-minute, 15-minute advisory on how to improve your sleep. Should our healthcare specialists deem that your problem is more acute than a session with, solely with them, we have the capability of graduating that platform and that program to the point where, if needed, we can schedule you into our health or medical and clinical facilities at Sequoia Hospital. So, Terry, that is Somnology.
So excellent. Let me stoop to some more basic info. My wife of over 50 years complained about me snoring. And so I brought that up with my family practice doctor, who referred me to a specialist. I suspect he's one of the 7,000 or so sleep specialists you were talking about. And I came in and spent a night sleeping in his facility in Sunnyvale. He attached 7 or 8, who knows, 10, I jokingly say 20. I show pictures to friends of me all wired up for the testing. And all I know is at the end of it, he said I needed a CPAP machine. So what in the world is a CPAP machine?
Well, by definition, a CPAP machine is an effective monitor and a process by which it is continuously providing you with airflow to open up to improve upon your oxygenation. The problem at hand, and that defined by sleep apnea, is a cessation of oxygenation to your cerebrum. And so what the CPAP, which is a continuous pulmonary, continuous positive airway pressure machine, does is to force air to you so that you can, limit such, episodic events as sleep apneas, and to be able to allow for you to breathe better. And Terry, in so many ways, is to be able to limit your snoring, which is caused by the fact that you're not getting enough oxygen.
So to expand on that, the same person who asked, how in the world do you get tested for sleep apnea, is, do I ever recover? Or is the machine mine for the rest of my existence on this planet?
Well, not being an expert and a specialist on the CPAP, I can't opine to that. But the thing is that sleep and sleep disorders are really a change of behavior. Okay, whether or not athletically through, or through dietary measures, or through the fact that clinically and medically, and maybe the fact that you've got problems breathing, oxygenation. It's very critical. And I found this to be very poignant, given the fact that this is Breathe California. And here we are, we're talking about a topical issue of oxygenation, which is inherently important for all.
Absolutely. I certainly have no desire not to breathe.
I wouldn't imagine you would.
So in an earlier conversation, you and I, you mentioned to me that there's a tendency to drift out of calibration for CPAP machines. What's that all about?
Well, good memory first off, in a sense that I did say that over the wear and tear of sleeping with a sleep PAP machine nightly tends to at times, kind of loosen to the point where using our methodology, of which we receive patents for, the methodology, diagnostic, and the process of sleep disorders, you can then understand on a daily basis or a periodic basis as to whether or not you're improving upon your sleep or not. And if you're wearing a CPAP, that might mean the fact that you may need to tweak your measurements to improve upon the calibration and to be able to improve upon the continuous pulmonary air pressure.
So I've been surprised that my sleep doctor has called me a couple of times and commented on information that the CPAP machine must have conveyed to him. Is that fairly normal?
That is. And we believe in this world of telehealth that you're basically now going to be able to be more efficient at being able to disseminate such information that you're gathering on your health. And this enables your board certified sleep physician in this instance to be a lot more efficient in being able to medically, improve upon your health.
So one of the things that's going to worry some of our audience who may think that sleep disorder might be appropriate is the cost of a CPAP machine. Breathe California gives them out to people. I don't know if they're charging or how they do it, but in my case, all the costs were covered by Medicare and my secondary provider, which is Blue Shield. Is that fairly normal?
That is normal, Terry, in a sense that it is costly. And not knowing who your medical insurer are or is, you should look into that because it is costly. And it is also costly in terms of your time, aside from the economics involved. Because at times, given the 1 to 20,000 ratio that I mentioned earlier, it may take you, in order to schedule a sleep test or what we call a polysomnogram test, up to several months. That's the beauty of our system, is the fact that you're enabled to be able to monitor your sleep character on a daily or a periodic basis, to be able to keep track as to how is sleep impacting your overall health. And you want to stay on top of that, because the thing is that the adverse impact of improper sleep on your overall comorbidities, as we call it in the world of health, is very impactful.
So what is comorbidities?
Comorbidities include that of Alzheimer's, various cardio-related diseases. We're focused on mental health and the treatment thereof, and certainly there's a correlation and adverse impact between sleep disorders and that, and many others. It's a matter of your system works fluidly and it works together. And the foundation of health, that of sleep disorders.
So you mentioned earlier a SomnoRing. What is that?
SomnoRing is a proprietary monitor that we have, that Somnology offers, that is a ring that you wear on your index finger when you go to sleep at night, and you engage your device in the morning by just pressing on start, and it transmits the data. Okay. And it is a very highly accurate measurement by which to monitor your sleep character.
So I want to expand on that a little bit more, but we're going to take a break for 30 seconds now from a public service announcement about one of Breathe California's programs. We'll back in just 30 seconds.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today. I would not take it back.
Welcome back. This is Breathe California TV. Every week we do a program that's focused principally on prevention, because I think the medical field is way too oriented towards treating problems and not enough push for prevention. So our guest today is Patrick Yam, CEO of Somnology. So under your name, it says your website, Somnology MD. Is there any significance to the MD, or are you just trying to highlight that you're a medical provider?
It's more the latter, Terry. And, you know, we're benefited here at Somnology by many, many astute advisors and members of our board throughout our country. On our board of directors is a former Undersecretary of Health, as well as a former U.S. Surgeon General. Our council of advisors go from one of the senior leaders, former leaders of McKinsey, which is a highly noted consulting firm, to the former CEO and president of Schwab Investments, to the former dean of law school at Santa Clara University.
Tell us a little bit about what got you into starting this business. I assume you started it.
I did. I am the co-founder, Terry. And quite frankly, you know, as your wife was asking you to attend to your snoring, and my wife did the same. My background goes back to the fact that, you know, I spent most of my career on Wall Street as an investment banker. And one of the early principles in the world of private equity back in the mid 80s. And then I built a hedge fund firm, which I managed several $100 million over, you know, from the late 80s to mid 90s. And I was one of the first professors of innovation and entrepreneurship. And I taught at Santa Clara University for 7 years in the MBA program. And so I got to thinking about, you know, and considering what my wife continuously said to me about my snoring. And I said, geez, I've got to think about this. And having had the opportunity of building companies and teaching the building of companies, I started Somnology in 2015.
So how have you done?
We've done well. Thank you. You know, one of our customers or clients is, you know, our attentiveness and that of health attentiveness, I should say, to veterans. We've seen over 15,000 veterans in the past year. Through our methodology, we've taken the proverbial 180-day wait, as I call it, and down to a full turnaround in evaluation and assessment in a period of 10 days. We have saved, you know, the VA and our collaboration partners quite a bit of money in doing so, and quite a bit of time.
Well, I couldn't possibly praise you enough for that. I feel pretty strongly that healthcare of our veterans is something that they're long overdue getting the same sort of thing that I can get in the private sector. Medicare has been very good about that, but I'm glad to hear you've done so well with that.
Well, thank you, Terry. You know, we also address others in the medical clinical arena. We also work with, you know, corporations, and specifically focused on anywhere from professional sports and athletic organizations to that of transportation companies to broader companies within the realm of corporate America. You know, today, one of the things we focus on, we highlight, is the fact that there are many, many people returning to the workforce. And there are many people being mentally challenged. The correlation of sleep disorders, treatment thereof, mitigates mental health. And so a lot of corporations are awakening that they can and should offer a graduated program so that they can, you know, look to the betterment of the health of their employees. This is offered as an employee benefit. And geez, you know, it may come about that it improves their productivity. And we hope so.
I would find it hard to believe that it didn't improve their productivity. It seems to me employers being concerned about the health of their employees is good for both the individual and the employee. So to work in obvious comments, your Somno ring sounds like an invention, even if it isn't your firm's, worthy of Silicon Valley.
Well, it's innovative, and that's the bastion of Silicon Valley. And how do we provide ease of use, the accuracy, and yet the flexibility, so that all, you know, here in Silicon Valley, we're always going at proportional speeds, you know, that limit our availability of time to be able to go and schedule an appointment anywhere. You know, our platform and program allow for you to do this without attending an office if need be. Okay. And so the thing is that ease of use, betterment of healthcare, and cost effectiveness are the three major critical factors we look at.
So you and I've confessed to having concerned spouses. If someone in our audience found themselves in that place, do you have a suggestion on what they do about it?
Well, thank you. I think that easily you can, you know, look up on our website, www.somnologymd.com, or reach out to me directly at 650-216-6800 and allow me to work with you, informing you about sleep, you know, adversities. I think that's the first step.
Yeah, well, there's no shortage of things. And it's an area where none of us think we look forward to sleeping, but not necessarily so sharp about knowing the importance of a good sleep. I feel pretty lucky that my whole life I viewed the most important thing I could do was, at night at least, was get a good 8 hours sleep every night.
Terry, you're a wise man. And I think the thing is, I drank the proverbial Kool-Aid as an investment banker, believing for many, many years that all you needed was 4 hours of sleep. Okay.
Ooh.
That is dysfunctional. Okay. And the thing is that people need to be cognizant of the fact that the impact from improper sleep needs to be remediated so that you can improve your overall health.
Yeah, I don't want to resort to information that's 60 years old, but my college, UC Davis, had a curfew where all students had to be back in the dorms by 2:30. And at the time, we thought that that was kind of a requirement, that you weren't having a good evening unless you stayed out till 2:30. But I always needed a good amount of sleep the next day, and I'm not sure I caught up so quick. Is it a fallacy that you just get 8 hours after an evening like that and you'll be fine?
Well, first off, as an emeriti UC trustee and having served 12, 13 years, I'm troubled to hear that. But certainly throughout our careers, I kind of adhered to a much similar program. I'll put it that way. I think the thing is that you need to be attentive to your sleep. Okay. I think it's subjective as to how many hours you need. Most journals I've read, and I'm constantly reading sleep on the subject matter, is the fact that minimally you need 6-7 hours of sleep. Okay. And sleep isn't a health platform where you can bank sleep on the weekends. You can't sleep 11 hours on the weekend and expect to be able to satisfy what you've missed during the week.
So I just got a signal we have 2 minutes left. Is there something that I didn't ask you wanted to talk about?
Terry, you've been extremely thorough. And first off, I've got to thank you and your media enterprise and those colleagues of yours for your consideration for the betterment of health for your audience and beyond. I think the thing is, the more people awaken to the fact that how disruptive sleep disorders are to your overall health, you'd be amazed. Okay. And certainly I was in starting this company and our clientele, and I thank you for being considerate and attentive.
Well, I got to say, I'm appreciative of an organization that's set up to help people this way. So you've got about a minute for rebuttal right now, paragraph or two, and we're done. 30 seconds. Any summaries for us?
I think the summary is, as I just shared, that be considerate of your one's health. You've got to take measures of improving your health by yourself. It's not a matter of the fact that anybody's going to be out there to tell you how to improve your sleep. Okay. We are a resource, and certainly we're a corporate resource working and attempting to work with corporations globally and beyond to be able to improve upon the health of your employees. And guess what? Many employees have come to me and said, geez, isn't it kind of neat that our employers are thinking about our betterment of our health? Of course it is. So thank you.
Thank you, Patrick. And next week, we'll have another show about protecting your lung health. See you then.